A 4-year-old boy presents with a suspected chest infection. I am showing you the chest radiograph. Describe the findings.
Let me just study this for a second. Right. The chest radiograph demonstrates normal lungs and pleural spaces with no evidence of active pneumonia or effusion. However, there is diffuse symmetric osteosclerosis affecting all visualized bones, including the clavicles, scapulae, humeri, and ribs. The bones appear uniformly dense and radiopaque with loss of normal corticomedullary differentiation. Additionally, there is mild widening of the proximal humeral shafts, suggesting an Erlenmeyer flask deformity. The combination of diffuse osteosclerosis and metaphyseal under-remodeling in a young child is highly characteristic of osteopetrosis.
What is the differential diagnosis for generalized osteosclerosis in children, and what causes the Erlenmeyer flask deformity?
The differential diagnosis for childhood osteosclerosis includes osteopetrosis, pyknodysostosis, renal osteodystrophy, hypervitaminosis D or A, and fluorosis. The Erlenmeyer flask deformity represents a failure of normal metaphyseal tubulization and remodeling during growth. Differentials for this deformity can be remembered by the mnemonic GNOME, standing for Gaucher's, Niemann-Pick, osteopetrosis, metaphyseal dysplasia, or piles, and hematological disorders like thalassemia. Lead poisoning can also cause dense metaphyseal bands resembling this deformity.
I am showing you 4 comparison radiographs: a femur, a tibia, a hand, and a forearm. Describe their findings.
The radiograph of the femur shows diffuse osteosclerosis and classic distal metaphyseal flaring, illustrating the Erlenmeyer flask deformity. The second image shows diffuse sclerosis and a transverse pathological fracture of the mid-tibia in a patient with pyknodysostosis. The hand radiograph in the third image demonstrates generalized osteosclerosis and pointed distal phalanges, which is a classic feature of pyknodysostosis. The fourth image shows a forearm radiograph with diffuse sclerosis and prominent calcification of the interosseous membrane and ligamentous insertions, pathognomonic for fluorosis.
Describe the pathogenesis, genetics, and clinical manifestations of osteopetrosis.
Osteopetrosis, also known as marble bone disease, is a rare hereditary disorder characterized by defective osteoclast function. Due to impaired bone resorption and remodeling, the bones become excessively dense but structurally weak and brittle. The infantile autosomal recessive form is severe, causing bone marrow failure, anemia, hepatosplenomegaly, and early death if untreated. The adult autosomal dominant form is milder, often asymptomatic, but can present with recurrent fractures and cranial nerve palsies due to neural foraminal narrowing.
What other classical skeletal manifestations are associated with osteopetrosis, and how would you manage this patient as a radiologist?
Classic plain radiograph signs include a bone-within-bone appearance in the vertebrae or phalanges, and sandwich vertebrae showing sclerotic end plates. For the infantile recessive form, bone marrow transplantation is the only curative therapy to restore normal osteoclast function. As a radiologist, I would recommend a complete skeletal survey to confirm diffuse involvement and refer the patient to pediatric hematology and genetics. I would also recommend baseline brain MRI or CT to evaluate the skull base for potential cranial nerve compression.